What if I offered you a miracle drug that when you took it, it had the ability to increase your body's use of fat from fat cells for energy? It improved your brain's ability for focus and made you feel more alert and more attentive. It improved your circulatory system's ability to get blood to the muscles of your body so that you could be more powerful and move more quickly. What if this drug also had the ability to, in the moment that you took it, reduce inflammation and actually release things inside the body that could actually help to treat things like dermatitis and psoriasis and rheumatoid arthritis? Is that something that sounds like you would want to try? What if I told you that taking this drug on a regular basis actually increases your risk of fractures from simple falls? And if you take it long enough, it can contribute to the development of diabetes and elevated cholesterol and even cardiovascular disease. That it can end up disrupting your sleep. And ironically, it can ultimately end up causing more inflammation in the body. And it actually end up leading to chronic pain and issues with, if you're a lady, issues with your menstrual cycle. Hopefully, after hearing that, you're going to pass on that drug, right? If you didn't, then I think it's time for you to make an appointment with your primary care and talk about your mental health. Now, the irony is that most of us would have said no to that kind of deal. And yet, on an almost daily basis, I run into people that are taking this drug all the time. And it's not FDA approved. It's not on Amazon. You're not going to find it at Walmart. What I'm talking about, stress. Stress, it's not just in your head. Listen, my name is Godfrey Alejandro Rivera. I am a board-certified physician assistant. I practice family medicine here in my local practice in Fayetteville called TrueCare DPC. I have a master's in physician assistant studies, and I have training from the Psychophysiologic Disorders Association, as well as previous experience before I was in medicine as a psychological operations sergeant, where I took the psychological operations course where we learned about behavior, human behavior, psychology, and behavior change. And then I have some experience outside of the clinic, again, within PSYOP and in the military, counseling and leading soldiers, and as well as biblical counseling within the church. Today, I'm going to be talking to y'all about stress. What is it really? I'm going to be describing the stress response, the mechanisms behind it. We're going to talk about neuroplasticity and how that relates to stress. And then I'm going to get specific into how stress affects women's health. And I'm going to share with you some strategies that I believe can help to actually get to some of the root issues when it comes to our body's stress response. And some other strategies to help manage stress in the day-to-day. And I'm going to talk about, which you may have heard me talk about many times before, the 5 pillars of health, which I believe that if people focused on these, they could put people like me out of business and it'd be a good thing. So before I go too far into this, I'm going to give you my essential disclosures. First of all, the things I'm going to share here, they're my opinions, okay? I don't represent any kind of organization of any sort, okay? I don't have any financial conflict. I'm not selling anything. I'm not getting paid to do this. It's just something that I'm really passionate about. And as always, this is not medical advice. I don't know who you are watching this. And if I don't know your situation, if we're not sitting down in the clinic discussing your personal care, these things that I'm going to offer you are generic things, and you're going to want to have a conversation with your medical practitioner. The idea behind this is to give you information to consider, to bring forth to your primary care practitioner to talk about if you have concerns about your health. So with that, let's go ahead and start in with what is stress. So stress is actually our body's response to various types of internal, external stimuli. Okay, so right off the bat, stress is very physical. Okay, and it's a physical response that our body is having to what we call stressors. Now, stressors are any kind of stimulus inside and outside of the body that generate that stress response. Over the years, we've come to define stress in a positive and a negative way. And positive stress we call eustress, and negative stress we call distress. Now, very importantly, you have to understand that what is considered positive for one person is not necessarily positive for another. In fact, it can be something that's distressing for another person. I know some friends that love eating vegetables. It's a good idea for them. And for me, it's distressing, the thought of having to eat vegetables. But I do it. I do it because it's good for my health, and I got small children, and I need to set an example. But it's a distressing thing. No, I'm just messing. But the truth is, it's important to understand. It's like everything else in life. We are all very individual, and the things that generate a stress response for us are very, very individualized. And this is important because when we're talking about dealing with stress, managing stress, and addressing those things, we have to appreciate that everyone else is unique, and it's not helpful for us to be comparing all the time and criticizing each other and ourselves, okay? Now, let's get into the general stress response that we all experience. Now, this picture describes this stress response. I want to direct you to the right side, okay? On the right side, you see the HPA axis, and that stands for the hypothalamus, pituitary, adrenal axis, okay? These are the 3 organs that are communicating to each other. And you see that box off on the top right where it says stress. It's indicating that when a stressor comes in, the hypothalamus is activated. It communicates to the pituitary gland via corticotropin-releasing hormone, and then the pituitary gland releases ACTH. That acts on the adrenal glands, which ultimately releases cortisol. And then if you look over to the left, you'll see where the spinal column is and the spinal cord. It has an arrow going straight to the adrenals because it has direct access to that, and that causes the release of adrenaline. All right, the big thing here is that these hormones that are getting released and these signaling agents that are getting released ultimately act on the entire body, right? All the way from the salivary glands down to your rectum, okay? Big thing here with the circulatory system, you get increased heart rate, you get increased blood pressure. With the digestive tract, you actually decrease the amount of focus on the blood flow and contractility because we're not, when the stress response is activated, we're not focusing on resting and digesting, we're focusing on whether or not we need to fight or fly, right? That's another word for the fight or flight response. These actions on the body are designed to prepare us for that action. The reason for the heart rate pickup, for the blood pressure pickup, is to get blood flowing to the brain and to the essential organs of musculoskeletal system so that we can react, okay? Suppression of the immune system in the acute phase is because we don't need those inflammatory mediators really going crazy on us right now when we're trying to survive. Now, in the acute phase, when there is a stress coming on, especially if it's some sort of danger to our physical bodies or even to our psyches, it's important to be able to take action quickly, right? And it's actually very effective and very efficient in the acute phase. But when this becomes a day in, day out type of thing, when we find ourselves in situations where our stress response is constantly being activated for various different reasons, we actually end up getting some very negative effects like the ones I described earlier. Right. And when you think about all the different systems that are involved in the body, you can understand why we see things like difficulty concentrating, headaches, changes in mood, issues with our heart rate, palpitations, chest pain, difficulty breathing, even stomach ulcers become a thing, and chronic pain and dysregulation of our sex. All these different things are happening because the stress response is overwhelming the system. Right now, of course, let's be clear here. There are multiple different factors going on for these different things, which is why I said this is not specific medical advice, but we need to appreciate some of these things can very much happen purely from the stress response. The question is, how does that happen? How do we get to the place where we take something that's very useful, very effective for our safety, and it becomes a chronic thing that becomes problematic? That's what brings up the topic of neuroplasticity. All right, so neuroplasticity, keeping it simple, is our nervous system's ability to adapt to the different stimuli. So from the time we're in the womb and we're growing, our brain and the rest of our nervous system is always trying to make the connections more efficient, prioritizing the things that we need, getting rid of the things or hindering connections with the things that we don't need, always adapting and modifying. And it's important to appreciate that the entire brain is really a network, okay? All these different network systems connecting to each other and affecting each other in some form or fashion. I want you to keep that in mind because even though we do identify different regions of the brain that become more active for certain things, it's still the case that the whole system is connected to each other, okay? And speaking of highlighting some portions of the brain, here we have a picture of what we call the limbic system, otherwise known as the emotional center of the brain. So these different structures that are highlighted here play different roles in the regulation of emotions. Right now, what I really want to draw your attention to, and I hope you can see it here clearly on the screen, is that right there, that bright blue little structure underneath the basal ganglia, underneath that big brown colored thing, you'll see what's called somebody we've seen before already, actually. It's the hypothalamus. That's our boy hypothalamus. Where did we hear about him before? That's right. We heard he is the H in the HPA axis. The hypothalamus is the H in the HPA axis, and it is a member of the limbic system. That's important. It's a member of the part of the brain that's processing emotions. Okay, now let's look at this. This image. It didn't have, when I pulled it up, it didn't have the actual hypothalamus drawn in, so you can see that little sketch I did there. But this image depicts what it's like when we receive signals, specifically in this case from images through our eyes, but also our ears are signals, sensory signals. When signals enter the brain, okay, those signals really quickly spread out into the different respective regions. And here in this picture, we're seeing that part of the signal goes to the frontal lobe, goes to the thalamus, goes to the occipital lobe, because that's where what we see gets processed, and it comes back around, ultimately making its way to the amygdala, and then finally to the hypothalamus. Okay, but what I want you to appreciate is that in this photo, we see the frontal lobe involved. And this is where conscious thought happens. This is where reasoning happens. This is where we think through things, come up with decisions, ask questions, all that kind of stuff. Okay. Now, with that in mind, what can sometimes happen, what often happens, is that the connection in our brain between seeing things and signals and engaging the frontal lobe can be disrupted. Okay, let me give you an example of what I'm talking about so you get a sense of what we're starting to miss. Let's say, for example, while you're watching this, you have other people in the other room and you hear a loud bang, right? You're like, oh shoot, what was that, right? Instantly, before you even can register what's going on, you're like, feel startled, you feel afraid, like what's going on? And then almost immediately, your mind starts racing with, what is that? What could that be? What did that sound like? Did it sound like an explosion? Am I okay? Is somebody else okay? Immediately, your brain starts racing with all these thoughts, and then maybe you call out, you're like, hey, what's up? What was that? Are you okay? And then they tell you, yeah, I'm fine. It was just this thing. Oh, okay. You hear that, and suddenly, boom, that stress response that was activated, right? Because you were immediately startled because the limbic system was getting going, is now calming down because the frontal lobe is involved. But what can happen is that connection can disappear or be hindered because the brain will adapt to basically skip that part and go straight to activation of the limbic system. And ultimately, you get something like this, which is described as the amygdala hijack. Now, I forgot to mention this, but the amygdala is the center that we associate with fear, with anger, frustration, being startled, and those kind of things. And when the frontal lobe is not involved in the way that we process experiences, we can go straight to the amygdala and have that activation of emotion without a clear understanding of why. Right? Without a clear, even perception of what's bringing about those emotions. Now, think about this. Why would that happen? Okay, why would that happen to somebody? Well, unfortunately, sometimes in this world, people grow up in environments where things are happening around them that are so threatening that what the brain is prioritizing, what becomes most important is figuring out how to survive, right? Not dealing with emotions, not feelings, not understanding your feelings, not recognizing when you're angry or sad or what it matters. No, it's not that. It's about surviving, right? So you get really good at picking out, reading people's behaviors, figuring out where things can be to hurt you and all that jazz. And so instead of worrying about how afraid you are, you're worried about surviving. All right. So then when things are happening, getting into processing those emotions becomes less important for the brain. Or maybe you were in an environment where discussing emotions, expressing emotions was frowned upon, was something that was discouraged. So you learn to repress them. right? You learn to stop engaging with them. And so then the brain gets more efficient at skipping the involvement of the frontal lobe and focusing on prioritizing the amygdala. That's one of the ways that this can happen. And then unfortunately, because this activation really escapes the awareness of the frontal lobe, the seat of consciousness, what can happen is that we later on in life will experience things that activate this limbic system, where the hypothalamus is at the end, and the hypothalamus is getting activated, and the stress response is going, and we're not even making connections between stressors and the stress response and how it's affecting us. You may have been in situations where you're talking about something, and before you know it, you're riled up, you're heated, and you don't know why. People are like, why are you yelling? Why are you so upset? You hear a story, you see something, and before you know, you're overwhelmed with emotion. You can't even, you're like, what's going on, right? Or unfortunately, maybe you had some pretty dramatic experiences, and you know that you've tried to avoid those things, but certain smells and certain sounds immediately, but before you can even make a decision about it, you feel some type of way. Well, when we are constantly trying to ignore that stuff, the HPA axis is still activated, right? The stress response is still going. And then what happens? That system's becoming overwhelmed. And slowly but surely, before we know it, we're not sleeping well. We're starting to get headaches, and we're wondering, maybe am I not drinking enough water? You know, your back starts hurting, like, oh man, I'm just getting so old, I need to change the seat. And next thing you notice, like, your appetite is changing, and you're not eating as good as you used to. And maybe you're thinking to yourself, I gotta stop eating out, or your bowel habits are changing, your sex drive is starting to go down, all of that. But you think, oh, I'm just getting older, I'm just getting tired, or it's just my work environment, I'm just stressed about one thing right now. And then we start looking like these people, and we have no idea why. And I tell you something, I see a lot of this all the time. People with chronic chest pain, unexplained for them, right? Normal workups, headaches, frequent normal MRIs, normal CT scans, stomach problems with normal GI studies, right? Normal gastrointestinal studies. They get scopes in the esophagus and in the rectum. They get CT, and it's all normal, right? Same thing with back pain. And what's really going on for many of these patients, I'm telling you, I've seen them get better, is when we start to dig into what are the underlying things, what are the things that led to that adaptation in the nervous system that's continuing to overdrive the stress response. Now, this is in general true for people, like men and women alike, and even children. But I want to get into the specifics of how this can uniquely affect women, right? Let's talk about stress in women's health. See, there's something unique about women that the men don't experience, and that's the menstrual cycle. Now, normally, and you may have heard me talk about this before, normally the menstrual cycle is like focusing on, we focus on the uterus and the ovaries, and you know, here we got menstruation with vaginal bleeding, and then the follicular phase and the ovulation in the ovaries. But as clinicians, we're supposed to be thinking about a little bit more than that, looking a little bit behind the scenes there. When we're looking at the menstrual cycle, we're seeing that there at the bottom, you have the same thing going on in the other picture. It's just depicted a different way. So the endometrial layer is changing, the ovarian cycle is displayed there. But if you look up top, where we have the hormone levels going on, I'm going to orient you to these arrows that I've put there. So let's start on the left, where the blue arrow is located. So here in the blue, with the blue arrow, you see that it's marking out for FSH, which is follicle stimulating hormone. And at the beginning of the follicular phase, it's the highest hormone here. And what it's doing is it's working on the follicles that are inside the ovaries, helping them to mature. And by doing so, through a series of steps, ultimately starts to increase estrogen levels. Then as we go along, we see a rise in estrogen. And along with this rise, we start to see a rise of this dark purple line here, which represents luteinizing hormone. And that's because as estrogen levels start to rise, it actually signals the body to increase its production of luteinizing hormone. And then when we get to this big purple arrow, we start to head into the spike of luteinizing hormone, which is essential for ovulation. We call it the LH surge. And then we keep going on into the menstrual cycle and fluctuate. You know, estrogen goes down and it kind of gets replaced in a way by progesterone. And then ultimately we start back over after a few different shifts. But the question that I want to ask to you regarding this is, where is this all taking place? Okay, is it taking place in the ovaries? Is it taking place in the uterus? No, it's not. It's taking place in the brain. Okay, there is our boy again, the hypothalamus. So the hypothalamus actually is responsible for driving this process by releasing what's called GnRH, acting once again on the pituitary gland. And that pituitary gland, again, this is in the brain, is releasing LH and FSH, which we just saw were an essential part of the menstrual cycle. They work on the ovaries, and then they result in the release of estrogen and progesterone. So here we have another situation in the body that depends on the hypothalamus. The hypothalamus, which is a member of the HPA axis, which is the stress response, and a member of the emotional center of the brain. Is it possible? Is it at all possible that if women are living with repressed emotions, past traumas, significant current stresses, a lot of pressures from their past and issues that are going unresolved, that somehow, especially if the frontal cortex is not engaged and the amygdala has taken over, that somehow the hypothalamus is being overwhelmed, and that there can be dysregulation of the menstrual cycle? Absolutely. Now, to be clear, I'm not telling you that every single woman with menstrual irregularities is the result of stress. There are other factors involved here. There's nutrition, there's sleep, there's other things that are at play. Okay. And again, that's actually why, one of the reasons why you want to have a conversation with your clinician to rule out other causes. But what I really want to highlight to us is that stress absolutely plays an important role in this. I'll tell you right now. Many patients that I've seen in my practice with significant premenstrual symptoms, right? Significant mood swings. I mean, scary mood swings, significant abdominal pain, bloating, back pain, irritability, have a very, very important story about their past that when it has been addressed, have experienced dramatic changes in their menstrual health. And unfortunately, I think because it goes underappreciated, and we focus so much on trying to measure specific hormones and doing these fancy labs, and we never ask our patients about their stressors. We never ask our patients about past life experiences. We never ask them about what's going on in here and how is that affecting them. We often can miss that, and we've gotten used to the idea that the time before menstruation and around menstruation looks like this. For many women, this to them is considered normal, and this is a joke. But many times, and not every time, but many times, this kind of miserable experience can be an indicator that we got some unresolved stress going on. I consider the menstrual cycle a vital sign for women. And for my female patients, no matter what's going on, I'm asking, I'm checking in, how is your menstrual health? Because it can be an indicator. And look, more than just menstruation, we also know that women, their mental health is different from that of men, right? So this is data from 2005. It was published in 2017, but unfortunately, the ratios haven't really changed too much. Right now, like men, we're still leading in when it comes to impulse control disorders and substance abuse, but women continue to be more likely to experience anxiety disorders, panic disorders, phobias, PTSD, and OCD. Okay, now again, this isn't just stress going on. There's other things, there's other factors, but let's be honest here. A woman's life is very stressful, right? Especially if you're trying to raise a family, especially if you're trying to balance family and career and societal pressures, right? And I see a lot of women who have come into adulthood and have difficult relationships with their mothers. And so that contributes to perpetuating a cycle of unresolved stress from the past, okay? And so it's definitely something that's going to affect women's mental health along with their menstrual health. And when we kind of think about that, and we can think about how this can also affect sexual health as well. I mean, a woman's vaginal health is intimately connected with her menstrual health, right? And that's because vaginal tissue responds very well to estrogen, and so estrogen fluctuations and changes impact how the tissue of the vagina, the lubrication of the vagina, overall libido and sensations and responses to stimuli, right? And so if your HPA is overactive, your hypothalamic pituitary adrenal axis, your stress axis is overactive, and your menstrual cycle is disrupted, okay, those are some things that you may experience. Many women who complain of vaginal pain with intercourse, especially with penetrative intercourse, have substantial history of stressful events that have taken place in the past. These can be sexual trauma. This can be a severe emotional trauma. This could be direct physical trauma to the organs and to the body. But very, very many women who experience dissatisfaction with intercourse, pain with intercourse, fear with intercourse, have some sort of underlying stress. Now, again, not all of them, and there are other things that could be involved. But it's one of the important considerations that we need to be thinking about when we're having issues with our sexual health. Are we ignoring? Are we suppressing? Are we repressing unresolved stress? Okay, and when we really consider the significance and the tremendous impact that it really does have, I tell patients now, when I meet a patient, I don't care what you're complaining about, I'm going to evaluate you for stress, for current stressors and past stressors. It's going to happen because I really do believe that everything we're talking about, this really does manifest itself in very real problems for people. And with that in mind, the next question should be, okay, so then what do we do about it, right? What if I'm wondering, what if it turns out that this is the issue, right? I've dialed in my nutrition, I've done all these other things, but I have unresolved things from my past, or I'm not being able to really manage what I got going on today. What do we do? This is where I like to bring up the feel to heal concept. Remember that what we got going on is an adaptation where our amygdala is taking over, right? The emotional center is really taking over, and the frontal lobe is not really involved in regulating emotion. So what we're trying to do is trying to restore that, okay? We're trying to get the frontal lobe more involved with regulation of emotion, and there's multiple approaches to do that. So here we have cognitive behavioral therapy, eye movement, desensitization, reprocessing, or EMDR, mindset coaching, mindfulness exercise. Now, I'll talk about compassionate inquiry in just a second. Most of these here are talk therapy, versions of talk therapy, and they all have their merits and they all have their usefulness. So cognitive behavioral therapy, one of the advantages is it really does work well for developing coping mechanisms and teaching you how to reframe, which is something I'm going to talk about in the next few slides. So you learn how to reframe, you get a lot of tools for managing stress and managing symptoms. EMDR is a great resource to help desensitize your nervous system, okay? So for managing the symptoms and the severity of the activation, EMDR can really help to calm a lot of that down. Mindset coaching, a good mindset coach will help you identify mindsets that are not serving you well and give you other ones that you can embrace, you can believe in, and start to apply those to help you begin to change the way that your brain operates and sees the world around. And then mindfulness exercises, practicing being aware of what you're thinking about, being intentional and engaging that frontal lobe when you're feeling things, asking yourself questions to get that front part of the brain involved in that emotional response. These are all very, very useful. Each one of them have limitations and benefits, and that's why the individual patient has to be considered for what works best for them. Now, I myself am very much a fan of the compassionate inquiry approach, really developed by Dr. Gabor Mate. I have spent time reading his material, watching his material, and so I apply a form of this, a less formal approach of the compassionate inquiry method. And the way I would describe it is I've noticed that, so with an appreciation for the fact that the brain is a very capable organ, I noticed that people have this way of putting up walls. And when we engage with patients, I notice that patients are able to say things that are embarrassing because they tell themselves, oh, you're the clinician, you're objective, you're not going to criticize me. But what that also kind of gets in the way of is the human connection that makes expressing these emotions, shameful thoughts, past guilt, things that we feel like we should have done and didn't, or did but shouldn't have done. When we're not talking to somebody we see as an equal human being, and we think of them as authority figures, or we think of them as people who are professionals, sometimes we can say things and not fully feel them. And compassionate inquiry tries to establish a relationship where we make it very clear that we are human, and we feel things and we hear you, but we're not going to judge you. And we're going to help guide you through bringing those uncomfortable things out, putting them into the light, calling out any nonsensical ideas, any useless thought patterns that have not served you, and helping you move forward to the things that are true, helping you engage in more useful ways of thinking regarding the past, but actually really bringing those things in the past to the surface so we can wrestle with them and ultimately heal. Now, there are some keys to success in any one of these, all right? You have to have a sense of safety, okay? So if you don't feel comfortable with the practitioner that you're dealing with, ask them if they can refer you to somebody else. Maybe there's a better fit for you. Sincerity is essential, okay? A lot of us to get through the day, we rely on little sayings that basically downplay the level of stress we're under, right? It is what it is, or what you're going to do, and that's just how they are. No, you have to be sincere. Like if you're constantly bound with this thought of like, that person is such a jerk, right? And I hate them, okay? And instead of being like, oh, no, that's mean, I can't say that, blah, blah, blah. No, like these are the times to really bring forward and then talk about and learn about why. What is it about that person or that thing or that situation that has you that way? And don't sugarcoat it. Don't make it palatable for other people, okay? And that requires courage. A lot of people are dealing with things from other people that they respect or they love or they feel some sort of obligation to. And it's hard to say those things. It's hard to come forward and admit those things. And so it requires courage. And it also requires consistency. Most of us make it into adulthood, having repressed things for a very, very long time. And so it's going to take some constant practice and patience because it's a process, okay? And very rarely are you going to resolve everything in one single session. Now, I have seen some dramatic changes in people when they do the work. Okay, when they engage in the process, I've seen dramatic changes, but it is still a process, especially when we're learning how to manage acute stress. And this is skills for those everyday things. We just live in a world where things become stressful. There's plenty of reasons to be stressed even now. Like even if you're not dealing with other issues, there are plenty of reasons to feel overwhelmed today. And so learning how to engage in things like breathing exercises. There's multiple different techniques. I'm a big fan of cyclic sighing. There's also box breathing. And there's other kinds of things. Matter of fact, here at Bliss Alchemist, there are coaches that teach you different breathing techniques to help you with mindfulness and help you with rest and relaxation. Physical exercise, 10 out of 10, recommend being physically active. Doesn't have to be a gym, y'all. Just being physically active, getting the endorphins going, reaching those goals when you're exercising. It's wonderful overall for our mental health and helps to relieve a little bit of that stress. Reframing, like I mentioned with CBT. Three questions are a simple way to start. Whenever you have something that's a thought or a process that's causing you stress, learn to ask yourself, is that what I'm thinking true? Where does that thought come from? And is there a more positive or useful way that I could think about these things? Something that helps your mindfulness and awareness is journaling. Very underrated by many people. A lot of people think of like a diary, but that's not what journaling really is. That's not how I approach it, at least. I recommend that you sit down, you write out thoughts regarding a topic that's messing with you. You can throw it up on the page, just write up a whole bunch of stuff. And in time, your brain will start to help you unravel those things. It can be very emotional and be very illuminating for people as well. And lastly, very importantly, confiding. You have to have people in your life that you can confide in. If I could prescribe people friends, I would. I'm telling you. Find somebody that you trust or a group of somebody that you can confide in. Now, before we close this off, I want to talk to you all about the 5 pillars that I wish if more of y'all would get involved in this, you wouldn't need people like me and we'd all be happier. I get a different job. All right, so the 5 pillars: nutrition, physical exercise, sleep, relationships, and spirituality. If you watch any of my other stuff, you know what I'm about to say. Literally, I say the same thing every time. For nutrition, I focus on mindful eating more than anything else. Why are you eating that stuff? Are you upset? Are you frustrated? Are you just tired? Is it emotional eating? Are you giving up on yourself? And that's why you're eating whatever? No, like why is it that you're eating what you're eating? Be mindful of that. As often as you can, whole foods, right? Things that are being prepared by you or someone you love, not a restaurant or fast food place, not out of a box. Okay, once in a while, not a big deal, but your diet can't consist of those things. And focus more on protein and fiber. Okay, before we worry about anything else, I find that if we focus on getting enough of these 2 things, everything else is easier to put into its place. For women, I recommend starting. Like you should be active and you should be consuming about 1.2 grams of protein for every kilogram of body weight. That's like, man, that's bare minimum. That's a little bit more than recommended daily allowance, but it's still not a lot, okay? Fiber, about 28 grams a day. Portion control. I'm telling you, we underestimate how high our portions are in this country. So we often think that what something is small portion, it's actually normal, and something that we think is normal is actually large. So we gotta be mindful of our portions, okay? And something that can be helpful is considering a food log. A lot of people get a lot of insight when I have them do a food log, and always avoid extremes. Look, I tell you something. The only thing I'm dogmatic about, the only thing I know, I'm very convinced about, is that Jesus died and rose again. Okay, as far as particular diets and diet camps, I'm not about that life. Avoid extremes. Aim for balance. Okay. Now, with physical exercise, so these are from the American College of Sports Medicine recommendations. Real quick, I just want to highlight a few things here. What I tell people is, if you're not getting paid for the way your body looks, I would rather you focus on strength. Listen, I'm still waiting for Calvin Klein to hit me up. I don't know if they lost my number, but in the meantime, I'm focusing on strength, okay? And to get strong, you want to focus on hard but doable. All right. Movement in general is great, but when we're exercising for health benefits and for management of stress and overall well-being, hard but doable is the name of the game. All right. When it comes to cardiovascular training, 150 minutes of that a week, spread out throughout the week. All right, moderate intensity means you're focusing on the conversation. You ain't just killing it, right? You're not just chilling on your bicycle, playing on your phone. No, like you got to focus on what you're doing, but you're not about to die on us, okay? And then this is a general rep scheme. Again, if you have like a trainer or a practitioner who can design something specific for you, but this is a generally good rep scheme for like development of muscle mass and strength, okay? Sleep. I'm telling you, y'all are sleeping on sleep, okay? Man, one of the first things people love to skip out on is sleep, and it's one of the most essential pieces, okay? Like, I got people asking me what supplements to eat, what food to eat, what exercise to do, and then when we talk about sleep, they're like, oh yeah, I get 4 hours of sleep. I get 2 hours of sleep. I'm in my bed, that's going all the time. And when we talk about sleep hygiene, they're like, my me time, I need to wind down. Look, I'm telling you right now, sleep is holy. Somebody asked me, how do you find time to work out? And I said, the first question I ask is, how much sleep do I need? That's the first thing. Because after that, I move everything else accordingly. Okay. Have a consistent sleep pattern, and remember that the bed is for sleep and sex only. I'm telling you, like, if you're regularly getting into bed to watch TV, the brain makes associations, and it's not helpful. And I'm serious, like, looking on your screen before you go to bed, you run the risk of activating something in the brain and now getting it on high alert before you're trying to go to bed. And aim for a minimum. This is like low, right? This is 7 to 8 hours, right? Relationships are an essential part of health. Okay, nobody lives in a vacuum. No one lives in an island. We are affected by the people around us, and so we need to invest time with the ones that we love. Okay, I recommend at least 3 people that you can seriously confide in, which we talked about earlier. And in good relationships, you learn how to establish healthy boundaries, and you learn how to communicate clear expectations. And I understand that sometimes the people that stress us out the most are the ones that we love, but that's why investing the time it takes to establish these things, the boundaries and the communication, is essential for our well-being. And lastly, spirituality. Look, spirituality is not religion. It has to do with what you believe about yourself and what you believe about the universe that you're in and your place in it. Okay, and it is important that you be intentional in establishing your identity. Almost every single one of my patients, I've asked these 3 questions, especially when we're talking about responses to stressors. Who are you? What does that mean for your life? And does the way you choose to live today accurately reflect who you are? All right. And I know that seems a little bit deep, but life is deep. Right. There's a lot of stuff going on in life, and understanding ourselves is essential to understanding the things that get us going and stressed out. Right. So with that, let's go ahead and summarize what all this was about. Look, stress is very real. It's a physical thing. It's a physical response in the body. Absolutely real. And it has legitimately and concerning health effects. It's not just in your head. Okay. You're not going crazy. You're not weak-minded. None of that. No, it's a physical thing. Okay. The brain adapts, and we can use that in our favor, or it can work against us. All right. Women specifically have unique challenges when it comes to stress because of the way that that affects the menstrual cycle, the way it affects their mental health and sexual health as well, in a way that is unique to them and is different from what it affects and how it affects men. And I do believe it is essential that we feel to heal, that we learn how to engage that frontal cortex, okay, that prefrontal cortex, engage it and help regulate our emotions and understand the things that have happened to us and make positive decisions about them, useful ideas about them for the future. And lastly, I say this again, focus on the 5 pillars. Put us out of business. That way we don't need to be prescribing stuff. You don't need to be seeing us all the time, and you can go on to live a happy, healthy life. Okay, now with that, I leave it open for questions for y'all to put in the comment section. Or to send me an email with any comments or questions you have after watching this. This is my contact information. You can reach me directly at this phone number. And if you want to check out my website, you can see it at TrueCareDPC.com. Thank you all for watching this, for taking the time to watch this. This is my works cited page here, which I can make available to y'all upon request. God bless y'all. Thank you so much for watching.